We'll now bring the health committee to order, December 8th to 20 and 9 p.m. Would you take roll, please?
Say that. I don't blame her not.
Bard,
Here.
Omenauer, Curtis.
Yes.
Dewey. Here. Lynch.
Here.
Sumall.
Present.
Awful.
Here. All right, may we have a motion to approve the agenda? Second?
I'll second.
Okay, any discussion?
She passed it out, she missed you.
Do we do all?
Sorry, I moved.
Oh.
I wasn't sure.
Okay, all in favor, say aye.
Aye.
Opposed? Okay, motion carries. All right, you should have gotten the claims for the animal control in your email. If not, we might have another extra one here. Go ahead and look over it, or if you have it, go ahead and leave a copy here. Any questions or discussions on it?
Do you want me to go get you a copy? Do you want me to print it out?
I'll give you a little bit of time here to look over it. And we're voting mainly on the animal control. Hey, Roger, are you okay with it?
Well, investigate small terrier running loose on Route 24, 2 miles east of Sheldon. I was wondering if that was the one that we're reading about all the time on Facebook.
So I can see it, can you show me it? Please.
The small terrier running loose on Route 24, 2 miles east of Sheldon. Was that the one that was on Facebook so many times?
I think so, but I'm not sure, because
Yeah.
some of them in
Because
the, try to catch them, and all the time she will reach the location, she cannot
Yeah.
find anything.
there were about 4 or 5 posts on
I
Facebook.
wanna, this, what type of dog is this one, because I can't take it.
Oh, this was 11/13.
And this one actually ended up hit by a car.
Oh.
Unfortunately.
Yeah,
Yeah.
I'll take care of that. You scoop it up.
Can we have a motion to accept the claims, please?
So made.
Thank you. And a second? And discussion?
Bard,
Yes.
Omenauer,
Yes.
Curtis.
Yes.
Dewey.
Yes.
Lynch. Sumall.
Yes.
Awful.
Yes. Any public comments? Okay, and I'd like to take this second here to welcome Mr. Lynch to the Health Committee. We're glad that you're here, and Mr. Zumal too. All right, we'll have a report from Dr. Youssef, please.
Yeah, okay. Good morning, everybody. Last month, unfortunately, Linda had coronavirus, and she has to stay home for almost 3 weeks. And she was sick, really sick. But thanks God, she's back to service now. She's back to work. I had to receive most of the calls, by phone, try to manage, the cases. We had 2 dogs, 1 cat, and we sent 1 cat to the lab for testing. Came back negative. She bit somebody. And a couple of bats came back negative as well. So far we don't have any positive rabies cases. So that's all what we have.
Okay, well, thank you very much. Any questions, anyone for Dr. Youssef? Well, thank you very much for coming.
All right, thank you. Absolutely, thanks.
All right, Dee Shepard, you're up.
Good morning.
Take it away.
I'm gonna go ahead and pass that stuff out to you. This is our regular summary report of programs. Hi, Mr. Lynch. I brought you one of these. They received that earlier, but that just tells a little bit about the health department and the services that we offer in the county.
Oh, thank you. Thank you.
So, we'll start off with the normal summary report of programs, and then we'll talk more about coronavirus here in a minute. And I'll answer any questions that you might have. You can see that during the month of November, our food sanitation inspections were down. That is because there are, first of all, a lot of places that are closed voluntarily. As you know, I did not close any restaurants to dining in person. That was a choice made by me. The Board of Health was supportive of that. I know that there are a lot of counties that are calling the state police if the local law enforcement isn't going to enforce. I've chosen not to do that in Iroquois County. I simply tell people that call, and I get complaints every day that they're open. I get phone calls on both sides every day. I walk a tightrope, as we've discussed before. But I feel like, personally, that the places that have remained open to indoor dining are doing everything possible to make it safe. Many of them have called and said, okay, what are you going to do to me if I stay open? I tell them that I will send them a letter encouraging them to close, but as far as that goes, that's all that's going to happen with the health department in Iroquois County. And then I have the support of the Board of Health. And when people call in and complain, I tell them that if they're concerned about it, that, don't go in there. That we have not had, we are able to epi-link our cases as we see them. It's not hard to do if you've been doing communicable disease investigation for a lot of years. There is a scientific process to it. We have not been able to epi-link cases to indoor dining. And until we have a situation where that becomes a problem, then it's not a problem. So, so we're not doing as many restaurant inspections right now because of that, and because I pulled the EH staff to help do contact tracing. They've been doing contact tracing on cases. As you know, when you get one case, you may have 20 people to contact trace, and that's very common. So we're focusing our efforts on known risks rather than focusing our efforts on unknown risks. And that's just something that, and I take responsibility for that. That was my decision. So some people agree with it and some people don't, and that's okay. But I will tell you that after working in public health for 28 years, we see a lot. We've always investigated cases. Every tuberculosis case in Iroquois County, every measles case, every mumps case, and those things happen, and we investigate them. We've had cases of of meningitis where, you know, I remember a case where a child died and we had to prophylax an entire school district. These things, we don't take these things lightly, and we don't take them, you know, our actions flippantly. We consider the consequences of every action we take, and we try very hard to make sure that we are mitigating where it does the most good. So that's what my EH staff has been doing, because I pulled them from doing routine inspections and to helping us with known cases. If you go down the list, before we get much more into coronavirus, if you go down the list, we're still doing water samples. Wells and septic, it's been pretty warm out, so there still have been some wells and septic things going on, especially in November. But now, as the ground gets frozen, that's gonna taper off, you know, for January and February. And you can look at where we're at year to date compared to FY18 and FY19 if you look at the far left, just to see what our numbers are and how they compare with the different services that we offer. We're still doing, you know, all of our normal things. We're just maybe not doing as much of it right now during coronavirus because the staff is being pulled. But you can look down at the water samples, the wells, the private sewage disposal, solid waste. We're obviously out of the West Nile virus surveillance months, so we're not going to be doing any of that during the winter. We don't have too many mosquitoes here in the winter. But you can see that, you know, what we are doing. And by looking at the different months, December through November of the fiscal year, you can tell that different months we focus on different things. So if you want, anybody have any questions about environmental health? Okay, if you go over to community health.
Actually,
Sure, go ahead.
so I'm the meat inspector for Iroquois County.
Okay,
Tapano has recently changed their licensing.
yes, we are aware of that.
And you guys are in charge.
Yes, we're aware of that. That has been inspected.
Okay,
And you, I'm sure that Ryan Wheeler, my Director of Environmental Health, would be happy to fill you in.
Yes.
They have been there numerous times, and we have had to have the state involved in that as well.
yeah, there's just a lot of issues.
Yeah, there certainly are.
I'm hearing more, the whole reason what happened was they recertified their license and got the slaughter operation up and running,
Right.
and then learned that we can't do anything in the processing operation.
Exactly.
And so they just were like, oh, well, I don't need that. And, I'm getting complaints like crazy.
Oh, yeah. I can tell you that at one time, and, you know, I usually don't talk specifically about cases during a health committee meeting, but I will on this one. We had numerous complaints because they had left animal body parts strung out outside like you cannot imagine, and the swarm of flies and the stench to the area was unbelievable. I actually we had one health inspector that came back and was not feeling well
Yeah,
after
no,
being
we
exposed
can
to.
definitely chat because,
Yeah.
the issues I know that are happening that I can't do anything about, we can talk about.
Yeah, absolutely. Yes, and we're definitely aware of that. That's an ongoing issue. So you can see our immunizations are about where they were for 2018. They're down a little bit from 2019. That's because a lot of the schools that are going remote, those children didn't, you know, are still in the process of being immunized, because we're still actually doing childhood immunizations from the October 15th deadline, trying to catch kids up. We are still doing all of our services, even though the county administrative building is locked. Obviously, you know that we are still doing all of our services, but we're doing them by appointment and not walk-in. Now, if somebody comes and knocks on our door, we don't typically turn them away. But we're making a conscious effort as we're scheduling these appointments, especially for immunizations, to make sure that we don't have too many people in the health department at one time, to decrease their exposure to one another. So, especially little kids, they don't keep their masks on, and they don't, they kind of tend to, my mom's filling out a ton of paperwork, they tend to be moving about, is a nice way to put it. So we are trying to schedule those so that we are minimizing anyone's risk at the health department. And that's been a new challenge, but it's been okay. It's working good. As far as animal bites, yes, we had 8 different animal bites in November. It was just a really heavy month for animal bites. We did have 3 of them that we had tested for rabies, as Dr. Yusuf said. One of the incidences that happened, I had to drag the specimen down to the state lab Thanksgiving morning. It had to reach the lab. The person was bitten by a stray. We had no way of knowing if that animal, had a rabies vaccine. We had no idea if it had come in contact with that. We had no idea, so we had to get that specimen down to the state lab. They were actually closed on Thanksgiving, but Dr. Connie Austin, the state vet, had made arrangements with Dr. Yusuf to have a security guard meet us at the lab and put it in the freezer, so that, or actually we froze it and then put it in a special freezer where it would quick thaw, so that they could test it first thing Friday morning, like at 5 a.m. So anyway, that's a whole nother story. There were some complications with that. But,
Have you ever gotten an animal bite that was by a cat and it bit deep into the skin?
oh yeah.
Do you advise those people to get on antibiotics immediately?
Well, what we usually only find out about an animal bite if that person goes to the emergency room, and they always give them antibiotics. That's usually how we find out, because their emergency rooms by law have to report an animal bite to the health department within 24 hours of the bite.
Because I was talking to a vet that works up at Bradley Clinic, and she said they just keep antibiotics there, and if one of the vets or technicians get a real bad cat bite, they just start taking antibiotics immediately.
Yes. Now, if it's someone's cat, we can prove that the cat's been vaccinated, and that's one issue. But this was a stray, and what happened was, while the individual was at the emergency room being treated for the cat bite, which they had to end up giving some stitches for as well. While they were there, they kept the cat, even though it was a stray, it was not acting right, and the person was going to help it. They kept the cat in a garage, and when they came back from the emergency room, the cat was dead. When you have an animal that dies that quickly, you need to have it tested to find out what they have just given that human being. So that's why I wrote it down Thanksgiving morning to make sure that it was down there. Normally, Linda probably would have done that, but plus, as he explained, she couldn't do that.
Cats have a pretty violent bacteria in their mouth that can make you pretty sick in a hurry, even though it's not rabies.
Yeah. So we were lucky in that it tested negative, and eventually, that is another story. I want to stick with her. Oh goodness. So you can see that we had a little influx of gonorrhea in the county.
Which I think a lot of this was because people hadn't stayed home and that kind of.
People really were staying home.
Not necessarily, I didn't chime in on the gonorrhea thing, but a lot of these situations, quit laughing.
I can't help it. We all need to do the, hey, listen.
Timing is everything, right?
We need cuts out so often every day. We need a good laugh.
You gotta have a laugh once in a while.
Absolutely.
No, I was just looking at a lot of the cases, and
Yeah.
Because if people stay at home, some of those things are triggered. Not gonorrhea, okay?
No, that's because they're not staying up.
I'm sorry, but you opened the door and I got to go right.
It's okay.
Anyway,
I
international
agree.
travel, to change the subject,
International travel.
international travel consultations. I don't know if I've ever seen that before. What is that?
Okay, so we haven't had a lot of that lately because people aren't traveling like they were. When someone is gonna be traveling outside of the United States,
Okay.
we do an international travel consultation with, David Hennig from the state. And he sends this wonderful packet for the people that tells them all about what immunizations that they're gonna need to get into that country, what diseases are prevalent, what preventive medicine they could take in advance. He tells them if there's safety issues going on in that country and where the more violent things are happening in that country, so people can plan around that. It's a really neat travel package.
Cool.
So we just need, when people call and want an international travel advisory package, what we do is we just get the dates that they're departing the US and where they're arriving, what country they're arriving in, and what area of that country they're arriving in, and their ages. We ask for the travelers' ages because different ages need different vaccines. Yeah, it's kind of a neat thing. So if you ever travel outside the United States, let us know. We'd be happy to get one of those packages for you. They're kind of cool.
Okay, for sure.
But right now, we're not seeing a lot of that because people really aren't traveling outside the U.S. right now. Obviously, we haven't done a lot of hypertension screenings. You know, some months we'd have, a lot of people come in to have a blood pressure check. People aren't coming in to have their blood pressure checks right now. They're staying at home. So, in many ways, those things are kind of a blessing for us as far as, we're able to focus most of our energies on the coronavirus stuff, but we still need to be doing our normal activities as well. And then, so any questions on that part of it? Obviously, right now, we're not doing a lot of the community outreach programs. Schools aren't letting visitors in, so we're not doing our education programs in schools right now. We're not able to do our vision and hearing screenings in the schools right now. And we're not able to do the dental sealant program in schools right now. And we're hoping that in the spring we'll be able to get in schools and get those things done. As far as our grant deliverables for those, we're sending a quarterly report saying that we haven't done any, We have not been told whether we'll be reimbursed for that or not be reimbursed for that, but those are not large grant amounts. And because we have had large coronavirus grants, fiscally, the health department's still fine. But they're telling us right now just to wait and see what happens after January as far as getting into the schools to do those school programs. Those are important. I have had a few teachers who have asked us for our videos for dental ed, for the little, program so the kids learn how to brush their teeth. And I did loan a teacher, our big teeth set and a big toothbrush and gave her some toothbrushes. And so they're doing some of that, on their own. The teachers are doing that with some of their classrooms. But that's one of the things that we love to do is teach kids. Because if you teach them young, then they take better care of their teeth as they get older. So, and our senior services programs are still up and running. The East Central Area Agency on Aging is not allowing home visits into the seniors' homes. So everything's done, like I have explained to you before, by teleconference or by, phone calls, Zoom, those types of things. But our job for the community care program is to help seniors stay in their homes, so it keeps them out of the long-term care facility. And they are still receiving their some of them are still receiving their in-home services, but they're limiting the amount of other people coming in and out of the homes. So, those programs are still going on, still functioning, but the senior service staff is also helping with the coronavirus cases. So, on the coronavirus. So, as of yesterday, we have 1,926 total cases that were tested positive in Iroquois County. Now, as I explained to you guys before, those are unduplicated cases. We have people who test positive multiple times, okay? But once someone tests positive and they're entered into INEDS as a case, any subsequent testing after that that's positive is just simply, we just simply merge that into the original case. So those are unduplicated numbers. We never duplicate. No matter how many, so in other words, no matter how many times somebody tests positive, they're only counting one. The total test results, the 24,045, that's the total test result. That has nothing to do with individuals. That's how many tests were run on Iroquois County residents. Now those test results are, once somebody has a specimen that goes to a lab and the lab tests for that specimen is reported back to the local health department in which the person lives. So even if somebody from Kentland, Indiana comes over to IMH and is tested, that does not end up in our total test results. Those total test results are only for Iroquois County residents. Okay? Because if we get somebody that's not inside Iroquois County and we end up with their test results, we transfer that out. Negative or positive. Okay? I know we discussed this last time, but I just want to clarify with you that we are using in Iroquois County that where it says probable cases on. You know, when you get this, you see this Facebook, and it has the probable cases. Those are the people who have tested positive using rapid testing that's not FDA or IDPH approved. Okay, there are lots of different rapid tests out there from different companies. Some of them are FDA and IDPH approved, and some are not. But these are the ones that are tested using a test that is not IDPH or FDA approved. So those people have tested positive, and they are treated exactly the same as somebody who has tested positive, you know, with a PCR test. Okay, so these rapid tests are antigen tests. These laboratory confirmed ones are PCR and molecular tests. So they're treated the same. They're still isolated if they test positive. Okay, we never report the number of patients on quarantine at any given time, because we've had times when there's 800 or 900 on quarantine. And people come and go out of quarantine so frequently to track that. We have a system that tracks that, but to report those numbers, it would change before the person could type the report out to go out to the press release. So we don't even try to do that. The state is still asking to include people who are, so we isolate the people who test positive and we quarantine their direct contacts. The people who are under quarantine who develop signs and symptoms, they're asking me to put them into the probable case category. I have declined to do that. Some counties in the state are doing it. Iroquois County is not doing that. I'm only counting cases that have tested out positive. If someone is in quarantine and they live with someone who has been isolated and has tested positive, and they start developing symptoms and get sick, chances are they have coronavirus. But based on the criteria for a probable case, a cough, just having a cough would indicate a probable case. Well, I'm not going to count people who have a cough. You can have a cough if you have allergies, if you have asthma. I have asthma, but I cough. You can have COPD, you can be a smoker. There can be a bunch of different reasons why, if you have somebody who has congestive heart failure, congestive heart failure, one of the biggest signs of that is a cough. So I don't count those people in our probable cases category, and I'm not going to ever do that. What I think will happen in the future is you're going to see the state is going to start looking at the signs and symptoms in Salesforce, which is the contact tracing software that everybody in the state uses. And they're gonna start looking at the people who are in quarantine who have symptoms and start counting them into a probable case category. Now, if that happens, if the state does that, our numbers will not match the state numbers. Well, I say so be it. I'm not willing to manipulate numbers. I think that's misleading to the public. I've always tried to be fair, honest, and transparent, and I'm gonna continue to do that, and, I won't count cases unless somebody actually tests positive. As of yesterday, if you notice, we sent out a press release yesterday that said, that the CDC guidelines for quarantine have not changed. Quarantine period was over 14 days. They're allowing health departments to have the option of letting people out of quarantine at day 10. If people are tested on day 6 or after, and the test results come back on day 8, they can even be let out on day 8. I am all for whatever is less restrictive to people. So some health departments are opting using that option, and some are not. I notified my staff, had a little meeting with them yesterday. As soon as that came out, within 5 minutes of that coming out, pulled them on and said, this is what we're gonna start doing. If people are symptomatic, then of course we want them to stay in quarantine. But if they're asymptomatic and have no signs or symptoms, at day 10, we're going to release them. We see a very small percentage of people that will develop signs or symptoms past that, day 13, day 14. So I have elected to go with that option.
So in a case like with me, so I got it, about a month ago, and the only thing that I lost my sense of smell, and that's not a normal symptom of any sickness for me. So I was like, okay, let's go get tested. Got tested, it was positive. Came home, rested for 3 days, never really got any more symptoms. My smell came back, and then I went down and got tested again, and I was negative.
But we wouldn't release you.
Right.
Exactly.
Well, right. But
Right.
that was a month ago.
Okay.
It's crazy.
Yeah.
Since then.
Yeah, because,
What, something you're saying now you might have, or you would, or?
yeah, now we'll release at day 10 instead of day 14.
Right, but if you get a negative test, you said possibly.
Yeah, if you're
day-
tested on day 6, the earliest you can be tested is day 6,
Okay,
according to the new CDC guidelines. So if you're tested on day 6 and your results come back, you could be released in 48 hours. So day 8
Day
would be,
eight is-
day 8 is gonna be the earliest you can be released. Mhm. Yeah.
So once having COVID, can you get it again?
Okay, so once you test positive, you're considered immune for 90 days. So for 90 days, you can continue to test positive for up to that 90 days. One of the reasons that's so important to know is because we have a lot of employers that are telling their employees, once they test positive and go through their 10-day isolation period, that they can't come back to work until they have a negative test. And I have to call all these employers and say, no, really, they can continue to test positive for up to 90 days. A test can pick that up for 90 days. They're saying, if we release them and they have a letter from the health department that releases them from isolation, please let them come back to work.
So what is the time period for to be contagious?
When someone's contagious,
Yeah.
usually people are most contagious for 48 hours before their symptoms begin or before they test positive if they're asymptomatic until they complete that 10-day quarantine period.
So the 90 days, they're not.
No, they're no longer contagious after they've met their isolation period, they're no longer contagious. And they're free to go about and go back to their normal lives. And if they're exposed to someone, let's say that they go back to work and then somebody that they work very close to turns positive, we do not put that person back into isolation or quarantine. Into quarantine because they've already been through isolation. So we would not re-quarantine someone for that 90-day period at all.
Now, what are your thoughts on the vaccine that we've been hearing a lot about coming in?
Okay, so Eric's gonna help me talk about this because, as you know, Eric is our public health emergency preparedness person. One of the things that he does as the director of public health emergency preparedness is get us ready to mass vaccinate the population. I led that effort. I had his job title back when we had H1N1, and we mass vaccinated about 8,000 people in Iroquois County, which is a good portion of the population. And we did that over, with each round of vaccine that we received through the Strategic National Stockpile, we had specific instructions. So this is gonna work pretty much the same way, but there are some differences. So we know that first round, so Eric, jump in here and talk anytime you want, but first round vaccines will come out. We know that the FDA is meeting on the 10th, which is just 2 days from now, and then the ACIP meets on Friday. So we'll know more then if they get that emergency use authorization for the vaccine. The first vaccine that's coming out is by Pfizer. It's an ultra cold vaccine. It has to be kept in a freezer that is
Negative 80 degrees Celsius.
-80 degrees Celsius. That's a cold freezer. We do not have one, and I did not order one. That vaccine can be kept on dry ice, but once thawed, has to be used within 5 days. We are prepared at the health department. We could set up a mass vaccination clinic. I've done it before. And during H1N1, and we can have one set up in 24 hours and it's rolling out. We practice it. We've done exercises. We've had runs. The paperwork's all in order as far as what can be in advance.
Should the Pfizer vaccine be pushed out? Should all approvals be met? And should the state push it out? It could happen as early within the next couple of weeks. It could not happen until January. There's a rumor floating around that Iroquois County would be one of the first counties to receive it. We have not confirmed that with the state yet, but we're preparing just in case. And should that happen, we're going to seek a limited amount, and we're planning where it's going to go already to make sure that we vaccinate our healthcare people first.
We'll have specific CDC and state guidance that tells us exactly who we can and cannot vaccinate during first round. It will be limited, a very limited small amount. We have been told that, and the hierarchy, I went over it with you guys a little bit yesterday in management, that's already changed. And another thing that changed was yesterday I told you that the second dose would be given anywhere between 4 and 8 weeks after the first dose. They've already changed that. It's gonna be 21 to 28 days. So this stuff changes on a dime, and we won't know until we get final information. But we do know that healthcare workers will be in the first tier. And our guess is that long-term care facilities and
Emergency responders,
paramedics, fire, police will be right underneath that, if not with it. And then it will be, elderly people who have a known diagnosed medical condition. Then it will be people ages 65 and older, and then it will be a while before the general public has access to this vaccine. And I told you yesterday, my best guess was probably April at the earliest before the general public can get this vaccine.
I think that's optimistic.
I think it is too. Well, we might as well not make people mad. During H1N1, Tom, I explained to them yesterday, during H1N1, one of the biggest challenges of the health department wasn't doing our job. It was dealing with the public who are very angry because they want that vaccine. There are people convinced that that's liquid gold, and they want it, and they want it right now, and they're not eligible for it, and we can't give it outside those parameters. And you know, because if you start doing that stuff, then you're not gonna get any more strategic national stockpile drops.
How prepared are you for that this time?
Um,
I feel like it's gonna be worse.
I
right?
think so, and actually, we've been talking with that a little bit. We know that there's a black market for this. We know that people are gonna keep trying to get their hands on it. We know that there could be issues. When we get a strategic national stockpile drop, it's dropped and then, it's dropped in an undisclosed location, and then we sign for it. Several health department staff go get it. We're accompanied by law enforcement. We don't know whether, at this point in time, where that drop is gonna be right now, because I've been told they may not use our known drop sites, because in the past, too many people are aware of where that's at. So it may be someplace different, and we will be given a 24-hour notice. Now, every time we've ever gotten a strategic national stockpile drop, and I'm guessing, I know we got 5 drops during H1N1, and we've had practice drops, and, you know, so I've done this a lot of times. Seems like they always come in the middle of the night, and they give us about a 4-hour notice.
But we're prepared for that.
But we're prepared for that.
Roger has a question for you. Roger?
Yeah, oh, I'm sorry, Roger.
Yes, when they announced that they were coming out with this vaccine and had tested it on some people, one of the things I heard that one of the effects of the vaccine was they felt like they almost had COVID after they got the vaccine. Have you heard that, or is there truth to
We
that?
have been told that there are side effects to the vaccine.
Okay,
That, not everyone will get them, but some people will.
Yeah.
That's like
So-
a day long, yeah.
Yeah, so we don't have that official information yet, because they really have not released the clinical trial studies, nor have they released any VAERS reports. VAERS is the Vaccine Adverse Events and Reaction Reports. We have not been allowed to see those yet. I've been looking at those now for 28 years of giving vaccines. You know, my child was the last one that got a chickenpox vaccine in Crow County before it was required for school. They had to have it by a certain date. He got it the day before. I study. We gotta wait and see. We'll have to look at this stuff and make a determination.
So,
And-
sorry.
I know your question. Is it gonna be mandatory for healthcare workers? Or EMTs or police or
We
fire?
can go there first.
Okay, if it is mandatory, I'm going to allow, local healthcare workers to waive it. I don't think anybody should be forced to take a vaccine that they don't want to take.
Yes, thank you, I'm sorry. I got
So,
Everything you've seen so far indicates it'll be voluntary, but we don't have the whole pie.
we don't have the whole pie. And if it's mandated that, IDPH workers get it, then I'll fight that in court if I have to.
Well, because I'm state employee, and I see it, I have that concern.
See what else. Any
What
other
you
questions
said-
Oh, yes, so I have seen a couple documents on a working list of, side effects. Is that real, or just making that up? You haven't seen anything then?
We've been given very, very limited information. So until I see it in black and white,
Yeah, it's kinda
I
rough.
treat everything as if it's skeptical.
Yeah, it's not, yeah.
And I certainly don't encourage anyone to listen to Facebook, because most of the stuff on Facebook is wrong. I sometimes I read that and I'm like, people can't possibly believe that, can they? Okay, I guess they do. Gee whiz.
If we're professionals working in the field, we can't tell you officially yet, then how can Facebook tell you?
Yeah.
Exactly, yeah.
Because people are smarter.
Yeah.
Yeah.
Fine.
Yeah, okay, we won't go there. We get cussed out every day, we get chewed out every day. I deal with complaints all day long. My cell phone number has been posted on Facebook so many times, my personal cell phone number. I get phone calls till 8, 9, 10, 11 o'clock at night, all the time. I deal with this day in and day out. I was very patient the first 6 months. Now I'm not so patient anymore.
It is amazing, and not just on this type of stuff, that people, well, I saw it on Facebook, and I sometimes feel like I'm Facebook police, but, and particularly if there's something law enforcement, you know, people are underneath cars slicing ankles or something from years ago. Hey, that's not true. Well, yeah, okay, but just in case. All right, I tried.
Yeah.
Well, I think you and your staff are doing a wonderful job.
Because they have worked, our staff has worked really hard. We have only, in the last 9 months, the only holiday that I closed the health department was Thanksgiving. I did not make, and I personally drove that cat down to state level, because I wanted my staff to have a day off. They have worked, every holiday, every weekend, you know, they are working. Unbelievable hours, and they work from home, and, oh, you talk about tired. Sometimes they are just exhausted. But they do this because they care about people. And it is our job to prevent as many, as you know, to prevent the spread of as many cases as possible. You know, our goal has always been not to overwhelm the healthcare system, and you know that over the last few weeks, the hospitals had no open beds. In Champaign County, in Iroquois County, in Kankakee County. I mean, there was no open beds. You know, folks didn't have people lining up in the hallways, but you know, Michelle Fairley called me, she was frustrated, you know, IMH had no open beds. People were sick. That's always been our goal. And when those things happen, that the hospitals get overwhelmed, I take that personally. It's my job to make sure that that's not happening. So we do the best we can. We mitigate these cases. We give people information so that we can prevent the spread as best we can.
When do you see, I know you probably can't answer it, but when do you think you'll see the spike going down?
Well, if I may,
Yes.
let's take some moments so I can explain what I passed out to you. That kind of will answer your question. I've numbered the pages 1 through 6 in the bottom right-hand corner. Page 1 is daily cases, but only for the last 2 months. As you can see, the month of November was horrendous. Our biggest spike of daily cases consistently since the start of the pandemic. We're still seeing way too many. It's gone down a little bit. Not too comfortable level, I should say. The yellow is probable cases, which Steve explained to you earlier. The gray is confirmed cases, and they're stacked on top of each other so you can see a combined total for each day. On page 2 is the same information since March 26th. So you just see a larger snapshot of time.
I'm going to interrupt you. He's going to go on. Let's talk about that one for a minute, just so that you have a good understanding. So when we had our first spike in April, we called that our first wave. We knew that there would be a second wave. If you guys remember me talking to you specifically, I said to you, we will get a second wave. There is always a second wave. Any epicurve, if you've done any epidemiological research at all, you know that with every disease, there's always a second curve, and sometimes there's a third curve. But there is always a second curve. Sometimes the second curve is worse than the first. So we knew that it was going to be. But I will be honest with you, this one even shocked me a little bit. And I've been looking at these epicurves and diseases for 28 years. And this was a little bit bigger than what I anticipated.
On that, do you think because we're so isolated in Iroquois County, this could actually be our first curve, because we almost had nothing? It was, even during the first wave, it was so low here, it seems like, is this the first, or is this actually the second? Nationally, it's the second.
I mean,
Locally,
it's relative. Back during the summer, I would have, this graph was a lot different, because
Right.
everything's relative. And I would have said, yeah, look, here's the curve. Compared to the second wave, it doesn't look
Okay.
like a curve anymore.
Right.
It doesn't. And this doesn't typically look like any epidemiological, and I taught disease detectives to the kids that took them to state, you know, I was like their instructor. And, this is not a typical curve. So you absolutely could be right.
Yeah, it makes sense to me.
So, this is a new one. This is, really is a new thing, you know? And lately, over the last few weeks, we have had people who are much sicker than the people who got it before, you know, in the months past. Much sicker.
Where the odds had already mutated.
Yeah, well, we know that that's happened. And viruses do one of two things, and I explained that to you guys over time. Remember when I showed you the other graph? Either viruses, as they pass from person to person, become stronger, or because of mutations, or they become weaker as they pass person to person. Remember me telling you that I was praying that this one would become weaker over time? It did not, obviously.
Multiple strains have been isolated throughout the world.
Yes.
So it definitely is mutating.
So
Bad thing is happening.
how could that then impact the effectiveness of the vaccine?
That's a good question. So let me answer that if you're
You almost
So-
got excited to answer
Well,
that.
it is, but that's kind of like a flu vaccine. In any given year, the flu vaccine that we give at the health department, now I choose which vaccine we give at our health department. I always pick a flu vaccine that has 2A and 2B strains in it, that's a quadrivalent rather than a trivalent strain. And I always pick one that's mercury-free and, you know, latex-free, and, you know, there's specific guidelines for these vaccines that I choose when I'm deciding which manufacturer I'm gonna purchase from. But the thing about a flu vaccine is whether you've got, as long as you've got a couple different strains of A and a couple different strains of B in it, the thing about that is all influenza viruses may be different strains, but they're very similar. They have common denominators. So if I vaccinate you against a flu vaccine and a totally different strain comes out, then it's not gonna help you. I mean, a totally, completely different strain from across the seas enters the United States. But most of them that travel around are seasonal, and so by getting a flu vaccine, even if you develop a flu that's not one of those 4 exact strains, there's enough common denominator in that vaccine that it will protect you against those influenzas. Or if you end up getting another strain of influenza, even if it's a brand new one, you will probably have less severe of a case because you have some antibodies built up that will help fight.
You're fighting
You know,
some of the virus.
You're
not
fighting,
all of it.
yes. You're fighting some of the common denominators that cause the same symptoms throughout all influenza viruses. So we're hoping that with coronavirus, the same thing happens. That by achieving some immunity to one strain, it will help with the other strains and make it, you may not prevent you from getting it, but if you get it, you'll have a less severe case. So we're hoping for that. Time will tell.
So it's more, so, okay, here's, okay, I'm not an anti-vaxxer.
No, I know that, it's okay.
But if I get a measles vaccine,
Mhm.
I'm not getting the measles. I mean, sure, there's those outliers, but
Right.
very rare.
Right, because there aren't really multiple strains of measles.
Okay, so that's
There
where
really
that,
aren't, yeah.
okay, so that's where that comes in, that makes this a little. bit
Measles
more-
is a more fragile, you know, disease, and some diseases, as they spread and mutations happen, those mutations kill that new strain off just because the mutations aren't well, the mutations don't really make it stronger, they make it weaker. So it's kind of like the term survival of the fittest, where things in your environment mutate and strengthen to survive. Not everything mutates and gets stronger. Some things mutate and get weaker and die off. So, you know, we were hoping that that coronavirus wouldn't mutate and create stronger strains. That did not come to fruition. So that's why it does worry us a little bit. more than other diseases where mutations end up killing off.
I'll go through this really quickly. Page 3 is cumulative from the start of the pandemic. And you'll see dotted lines and straight lines. The bold lines are the confirmed cases, the dotted lines are confirmed plus probable. You can see that on the legend on the right. As you can see, I have trouble with colors. I think that's yellow or orange or gold.
Yes, yes.
Thank you. Iroquois County remaining is around the highest it's ever been, which is, that's the bar that will go up and down. The blue lines at the top, they'll never go down, they're just gonna continue to go up. That's confirmed and confirmed plus probable cases. On page 4, and I won't get into page 5 and 6, you can look at that later, it's pretty simple. I just want to explain one thing on page 4, that's the state of Illinois. You see the recovered and the remaining lines, they're a bit jagged. That's because the state of Illinois does not publish people that have been released. They don't give a number for that, they give a percentage. And I use a formula to figure out what that is, but the formula is not exact, so that's why I get a jagged spike on that. If you have any questions about the charts, let me know. But to answer your question, Ms. Awful, about when we're going to see it start to go down, I don't know.
I'm sorry, I didn't hear you.
We don't know.
I don't know.
But it has eased up to some degree, am I correct? I mean,
It's eased up and it's gotten worse. It comes in waves. After Halloween, it got really awful. And
I'm talking about from that super high peak caused by weddings or whatever to now that it not that anybody should be in the dark about, just that it's subsided to some degree. Even hospitalizations, now I realize you have deaths that contribute to some of that, I get that, but. So I'm pretty much misinterpreting.
No,
that.
not necessarily.
I mean, I'm not
But
ready
right
for
now,
work,
I'm still waiting, I'm still waiting, we're only at, what is it, December 8th? I'm still waiting on, some of that.
I'm sorry.
Thanksgiving.
But should
And that
we
weekend,
but we're almost out of the real crucial days of.
By December 10th, if I don't see a spike over the next couple days, I'm gonna feel a lot better. Yeah. The problem is, a lot of people just didn't go get tested, because they knew that they were around their family members. Doesn't mean there's less illness out there. There's a lot of people that knew that they were with their family members, and they know that if they go get tested and they're sick, that their family members are gonna end up in quarantine, and they don't want that to happen. So we've got a lot of sick people staying at home right now too. And that is something that I am aware of, because they're calling in and saying, is there any way I can get tested but do it privately enough that it won't be reported to the health department? There is no way to be tested for anything on the Illinois reportable disease list and not have it reported to a health department. That isn't possible. The labs would not report to us, so.
I do think a lot of people did get together like they usually did.
Oh, I think so too.
And a scaled down version,
Yeah,
but then it got
absolutely.
even more scaled down, and then it turned out who were always around all the time anyway.
Yeah.
A very small group.
I think the numbers I saw were that it was slightly more people traveled using airlines than did during the 08 crash. So our population's gone up a lot, and there was a lot of people who didn't go anywhere then because there was no money. But it's still, I think more people went out.
Okay, I think, we could probably discuss this for.
Oh, yeah, ever.
Do you have any more to report?
Thank you. Okay.
All right, well, thank you very much.
Thanks.
Have we got any old business? New business? We have a motion to adjourn. Second. All right, all in favor, say aye. Aye, opposed, meeting adjourned. Thank you very much.
You're welcome.
watched 50 of them. It was